Clinicians are always looking for ways to deliver a safe, efficient, and effective training to patients. Flywheel training has recently gained traction for this purpose due to the unique loading it offers combined with a small and versatile footprint. Traditional training methods involve lifting weights against gravity. While this can be effective, it does have some limitations, including having to carefully prescribe the external weight lifted by each patient in a limited eccentric load. On the other hand, flywheel training uses rotational inertia to generate resistance. This has several unique characteristics that are valuable for clinical settings, including user-defined resistance and a higher eccentric load. User-defined resistance refers to the fact that flywheel loading is directly tied to how much effort or input the user provides during each repetition. The harder they push or pull against the rope during the concentric phase, the more energy is stored into the flywheels, which is returned as an eccentric resistance on the way back down in an approximately 1-to-1 ratio. This has a few unique benefits for clinical settings. First, when you're introducing the method to a new patient, you can have them start with submaximal intensities and put less effort into each repetition. This allows them to gradually build confidence and acclimate to the loading before increasing the intensity. Second, this provides a natural safeguard built into flywheel training. If the patient begins to fatigue, they're going to progressively put less energy and force into each repetition, and the loading will scale down accordingly. Finally, user-defined resistance means that there is a natural progression built into flywheel training. As they get stronger and build more confidence with the method, they'll be able to put more force in, and the resistance will scale up as they improve. An additional advantage of flywheel training is the unique eccentric loading that it provides, where the muscle is producing force while it is being lengthened. Muscles can produce higher force and power during eccentric actions, all at a lower metabolic cost. In addition, eccentric focused training allows you to provide unique adaptations to muscle, connective tissue, and the nervous system. Eccentric loading that scales to the capabilities of each patient makes flywheel training a safe, effective, and individualized training method for clinical settings. If you're interested in learning more about how flywheel training can be used in clinical settings, check out some of our other resources in the description below.